Hey everybody, Michelle Nesky, the Posh PA, here to talk to you a little bit about how to handle medical advice requests from your friends and family. Because now that you're a PA or even a PA student, those requests are going to start trickling in. So I think that most medical providers are not going to shy away their friends and family who ask them for advice. But I do feel like there needs to be an expectation of what the outcome is going to be on both sides. With that being said, I personally feel that being directly involved in prescribing medications or in the care of a friend or family member can be a conflict of interest, and I usually shy away from that. In terms of medical advice requests, I sort of think about three things when I'm approached with a question. Number one, who's asking it? Number two, what's the question? And number three, am I comfortable? Those are the three things that I think about with anybody that approaches me for medical advice. So first of all, if it's my spouse or my sister or somebody that I'm super comfortable with, then if it's a very simple question like, oh, I have a rash here, I don't know what to do, then I'll get on a FaceTime, we'll get face to face, we'll take a look at it, I'll make some suggestions, and then I'll say, hey, if this doesn't go away with this in the next 24 hours, you need to go see your doctor, right? At the end of the day, I'm almost always referring my friends and family back to their provider because I am not their physician or PA, and there may be details that I have no idea, what is going on. But I am okay in that situation to make suggestions, and then if things don't get better, then go to your doctor. Another situation might be if my neighbor calls and her son fell and hit his chin on the porch and he's bleeding all over the place. Of course, I'm going to run over there and make sure he's okay. But at the end of the day, if I feel uncomfortable with the situation and I'm like, I really think he might need a stitch, he needs to go to the emergency room, he needs to go to the emergency room. He always is going to need, I'm always going to recommend that person follow up with their provider or go directly to their provider. So those are sort of some simple situations in which I would feel comfortable offering suggestions, but again, ultimately refer them back to their provider. If it's a question I'm completely uncomfortable with, I'll just say, listen, I don't think you should be relying on me for medical advice regarding this topic. I'm really not comfortable with this. This is outside of my scope and what I normally do. And I'll say that because I don't want to put myself or my friend or family member in a weird situation or give them wrong information. So that's how I would handle that. Now, being an oncology provider, I often get requests to talk to people who are diagnosed with cancer, whether that's a family friend or a relative. And in that situation, I really need to be careful about what I'm saying to these people because I don't know the details of their case and I'm getting secondhand information. So it's from their doctor to them to me. And in that chain, a lot can be lost. And I don't have the details. So all I can really do in those situations, although I really want to help, is say, I really want to help, and without all the details, this is what I can tell you. And I can provide factual information about, their diagnosis, but really what is most valuable to them is the questions, providing them with questions that they need to be asking their physician about the diagnosis, the treatment plan, what's the next step, and all of that, right? So that I feel is the most valuable input I can give to them. I do not want to get in the way of the care that an oncologist is giving their patient when I'm 3 people removed from the situation. And so providing them facts, giving reassurance, and giving them suggestions on questions they should ask sort of step by step is really the best way that I can help them without getting too sort of deep into the situation, if that makes sense. Because I am here as a resource. I'm here as a resource for them. I'm happy to help. I always am. But there are certain boundaries that I need to set for myself as a provider and as their friend or family member because, you really don't want to get in a relationship, get the relationship to be convoluted and really affect that relationship that's important to you from a medical situation. So if you're uncomfortable, always defer. At the end of the day, like I said, even if I'm giving a simple suggestion and I feel comfortable about it, I always will recommend that they follow up with their provider. If it's somebody that I don't know, I will almost always send them directly because I don't know them at all. And so if it's like a friend of a friend that I've never met, you want to just be careful about any advice you're giving to people that you don't know that well, or at all. I would shy away from that and just say you're not comfortable. But at the end of the day, there are many different requests that are gonna get thrown at you. So whether that's, oh, my ear is killing me, do you mind looking at it? Or hey, I have this red spot on my arm, do you mind looking at it? I'm gonna send you a picture. Those are things that you have to gauge your comfort level with. But to be on the safe side, I would almost always recommend that they go, get a full evaluation and be checked out. And again, I never get directly involved with prescribing medications to friends or family. I just shy away from that. There are, no matter how well you think you know someone, there could be details of their medical history that you don't know. And prescribing a medication for them could be really dangerous if you don't know that. So I would really shy away from that. And I usually do. But that's the way I sort of approach any medical advice request. Who's asking? What's the question? And am I comfortable? If I follow those guidelines for myself, then I almost can never go wrong. And I can help as much as I can, but still maintain my boundaries as a medical provider, as I am not their medical provider. Hopefully these tips helped you. If you have any questions, please feel free to send me an email, DM me here. You can check out way more information on my website at michellenesky.com. Have a great day, guys.